Hello everyone, my name is Oso Gurung. I am one of the student nurse studying at Wollongong campus. For today's presentation, I'm going to discuss about cardiovascular health, hypertension in adults mainly. Uh, for today, I will be presenting as a community nurse and I will be explaining as simply as I can so everybody could understand. So for today's agenda, I have divided into different categories like statistics, the statistics, complications, personal reasons why I chose this topic, health promotion, strategies to maintain, to prevent, or to do what's after next, and the support system, multidisciplinary team, like identification and discussion of multidisciplinary professionalism for it. So cardiovascular health, it mainly consists of our heart, blood vessels, capillary artery, vein. Hypertension, the hypertension is like high blood pressure. So when we measuring the high blood pressure, we have like two values, systolic and diastolic. Systolic is usually the upper one, diastolic is the lower one. We have different criteria to get as a hypertensive. So from the statistics, 34% of the adults have had high blood pressure, 23% were uncontrolled, and 11% were using the medication to control the high blood pressure. Uh, it's also called silent killer because of the symptoms that we get it. It's very quite noticeable. So why I chose this high blood pressure, hypertensive, is like it's as a motto as a student nurse slash registered nurse, we see it like very often in the hospital settings, and like the role of family, raising awareness and support in the Australian scenario, and understanding the main reason is understanding why and how it occurs. So we have health promotions and illness prevention. Health promotion is defined as a process of enabling and like increasing the control over to improve their health. Now, there are different health missions going on to prevent the cardiovascular disease like hypertension. Illness prevention is like basically strategies and action to minimize the risk of this disease occurrence, like to prevent. So the government has funded $220 million, like budgeting to get around the professionals for maintaining the cardiovascular health in adults in Australia. So the strategies goes like primary strategy, secondary strategy, and tertiary strategy. Primary basically means action to prevent the initial development of disease, and secondary early detection and intervention to identify and manage diseases. Tertiary is like focusing on managing and improving the quality of life for individuals with existing diseases. It includes like offering stress workshop, mindfulness, and conducting blood screening test, and like offering telehealth services. Australian government from Department of Health, like it's mainly about rotating about the strategies. We have multidisciplinary team, like it's like basically like a combination of professionals to encourage us to maintain this CVD, or like cardiovascular health. So some of them are cardiologist, registered dietitian, physical therapist, health education, and more on. And like there's also support system like raising awareness program, making campaigns like as we are doing now. So just to keep in mind, like cardiovascular health is very important for us. Like it might be the cause for many chronic diseases. In conclusion, maintaining your cardiovascular health is very important. So thank you for the presentation. Thank you for listening very patiently. Hope you